Thank you, Mr. Chairman. My amendment is simple. It strikes all the current text of the bill and replaces it with language that codifies the short-term limited duration insurance rule and allows for guaranteed renewability. Why do we want to codify and strengthen these plans? Quite simply, these health insurance plans guarantee access to an essential benefits package picked out by the patient, not the government. On August 3, 2018, the Trump administration released the final rule returning the definition of the STLDI plans to what it was before President Obama's 11th hour definition change in January of 2017, allowing renewability for up to 36 months. The Obama administration's rule overturned 20 years of regulations by limiting these plans to only 3 months. Instead of working to make health care more affordable for Americans without employer-sponsored health insurance coverage, President Obama decided to decrease availability, affordable options, and limit the length of time a consumer can maintain a short-term limited plan. Thankfully, the Trump administration acted in August of 2018 to revert definition to a short-term limited duration insurance plan back to what it was for the prior 20 years. Including the entire Obama administration, to create more flexibility and affordability in the healthcare marketplace. You may hear some of my colleagues from the other side of the aisle label these as, quotes, junk plans, end quotes, except they were available in the current form during President Obama's entire time in office, and none of my colleagues at that time called them junk plans that I recall. What is a junk plan? One that doesn't provide superfluous coverage that you don't need. What do seniors do with Medicare Advantage or Part D? They buy the plan that meets their needs, not some government mandate. In my state, Medicare Part D has 29 options for Tennesseans to buy prescription drug coverage. I understand my colleagues in the majority believe changes are not needed to the ACA, but it's easy to see that it's failing many Americans. In my district, about 20,000 individuals purchase their insurance through the exchange with a subsidy. But roughly 15,000 individuals paid the penalty. 15,000 people in my district paid a fine because they couldn't afford it. And why'd they do that? Because of sky-high annual premiums, high deductibles, and government-mandated benefits that patients don't need or want. These plans often provide you nothing more than a card in your wallet. And for full disclosure, I have ACA insurance. I'm insured by that plan. In contrast, these short-term plans are really essential health benefits. They're just essential health benefits that the patient deems to be essential to them and their family. Look, we all have different needs at different points in our lives. I understand that. My wife and I don't need maternity coverage at this point in our lives, for instance. And I thank goodness for that. Because the ACA prevents policies from being sold that are tailored to an individual that have an affordable option for consumers since the Clinton administration. This committee and Congress as a whole should be looking for ways to make health coverage more affordable for Americans, not working to eliminate coverage options that have been available in this form since the 1990s. And Mr. Chairman, just to pass along, another, this is not germane today, but the Association of Health Plans. I was in Washington State, and the state has a Association of Health Plans, 8 different plans that have been functioning well for over 20 years in that state, to help lower costs and increase access. And look, I agreed with that with the ACA, that we should lower costs of health insurance coverage and increase access. The problem is the ACA hasn't done that. If you get a huge subsidy, it helps you. If you do not, it may be completely unaffordable. And Mr. Chairman, I appreciate your indulgence, and I reserve the balance of my time.